Assalamu alaikum. Myself Mahmoud Al Islam Ansari, currently studying in BDS third year. Today I will discuss about muscles of mastication, anatomy, function, and clinical features. Index. Here we will discuss about introduction, muscle of mastication, masseter muscle, temporalis muscle, medial pterygoid, lateral pterygoid, accessory muscles of mastication, masticatory muscles disorder, then summary. First, introduction. Mastication means chewing, mechanical breakdown of food. Muscle involves are primarily masseter, temporalis, medial pterygoid, and lateral pterygoid. These muscles are originated from the first pharyngeal arc and are innervated by the mandibular nerve, which is a third branch of trigeminal nerve. Then we will discuss about the main muscles of mastication, that are masseter, temporalis, medial pterygoid, and lateral pterygoid. Here, right side, you can see the pictures of temporalis, masseter, lateral, and medial pterygoid. Now we will discuss one by one. Masseter muscle originates from zygomatic arc and inserted into the angle and ramus of mandible. Action elevates mandible, closing of jaw, helps in closing of jaw. Nerve supply, masseteric nerve, anterior division of mandibular nerve. Blood supply, masseteric artery, branches of maxillary artery, venous drainage through masseteric vein. Then I discuss about temporalis muscle, originate from temporal fossa, insertion into coronoid process of mandible. Action elevates and retracts the mandible. Nerve supply, deep temporal branches from the anterior division of mandibular nerve. Blood supply, superficial temporal artery, branches of maxillary artery, and superficial temporal vein and branches of maxillary vein. Now medial pterygoid originates from medial surface of lateral pterygoid plate and inserted into medial surface of mandible near the angle. Action elevates mandible and assists in side to side movement. Nerve supply, branch of the main trunk of mandibular nerve. Blood supply, pterygoid branch of second part of maxillary artery, and pterygoid plexus drains into the maxillary vein. Now lateral pterygoid originate from lateral surface of lateral pterygoid and insert into the neck of mandible and articulating disc of temporomandibular joint. Action depress and protrude the mandible, moves it side to side. Nerve supply, lateral pterygoid nerve of anterior division of mandibular nerve. Blood supply, maxillary artery, ascending palatine artery, and pterygoid plexus drains into the maxillary vein. Now some accessory muscles of mastication with their nerve supply. Digastric muscle, anterior belly by nerve to mylohyoid, posterior belly by facial nerve. Mylohyoid muscles, nerve supply, mylohyoid nerve, and geniohyoid muscle, olfactory nerve supply. Then stylohyoid muscle and buccal muscles are supplied by facial nerve. Masticatory muscle disorders. Temporomandibular joint disorders may be occur due to jaw injury, arthritis, malocclusion, stress, and many other factors. Bruxism, teeth grinding, and trismus, lockjaw. Masticatory muscles disorders like other disorders like tetanus, congenital hyperplasia, hypoplasia, temporal tendonitis, myositis ossificans, muscle pain, and myofascial pain. Summary. The muscles of mastication are a group of four primary muscles responsible for movement of the jaw during chewing. These muscles include masseter, temporalis, medial, and lateral pterygoid. The masseter is a powerful muscle located at the angle of the jaw, essential for closing of the jaw. The temporalis muscles, a fan-shaped muscle on the side of the skull, also aids in closing the jaw and retracting the mandible. The medial pterygoid assists in elevating the jaw, while the lateral pterygoid is crucial for opening the jaw and enable side-to-side movement of the jaw. These muscles works in coordination to facilitate the complex motions required for effective mastication. Thanks for listening. That's it for today. If you like my videos, like, comment and share and subscribe. Thank you. Bye bye.